In this video, I want to be talking all things shoulder joint and why we get a pain, perhaps in and around this area, most notably when we lift up our arm. So let's go, and thanks for checking out this channel. My name's John, head therapist here at John W Sports Injury. If you're new to this channel, great to have you. We want to do three simple things here. Help you understand your body, get rid of pain and weakness so you can strive on and hit your health, well-being, sport, exercise goals. And one thing that commonly can stop people in their tracks is this annoying shoulder pain that we get around the tip of our shoulder here. And as I mentioned, most noted when we lift up our arm towards 90 degrees. If that's happening to you, I want to explain why it happens and some of the things that you can do in order to help it. So firstly, let's talk about some of the things I like and don't like about the shoulder. Well, the shoulder joint is held in place predominantly by four muscles that form what we call the rotator cuff. The rotator cuff is something that I speak a lot about, and at the end of this video I will link to a more detailed video where I describe the various components of the rotator cuff and how you can assess and look after yours. But that's a good thing because it allows us, or the structure of the joint allows us to have lots of movement at this shoulder joint. So that's great for lifting, throwing, and generally moving our shoulder. But what's not so good about it is this huge reliance on the rotator cuff means that actually the joint is far less stable. So we can develop dysfunction in the shoulder joint easily. And that's relevant for what we're going to come to talk about now, which is why we can typically get this pain at the tip of the shoulder. So what we want to understand first is a real quick bit of anatomy around the shoulder joint. So the shoulder is formed by the top of our arm bone or our humerus coming into this shoulder blade area or our scapula. And that forms the joint. Now we have this really important bit of space between the two that we call our subacromial space. Now, as you can see here, there's lots of these tendons running through this space, and that becomes really relevant if you are suffering this type of injury. And I'm going to demonstrate that using this cord. So one of our rotator cuff muscles is called the supraspinatus. That means on top of spine, and it's because it sits on top of the spine of the shoulder blade. So it effectively is a muscle that runs through this channel here. So that's moving through that channel. So we can actually get in and feel that muscle. Now, you've got your upper traps on top, but also deep to that, if we get into this groove that you might feel in your shoulder blade, is your supraspinatus muscle, and that lifts the arm out to the side as well as stabilizing the shoulder. Now, what then happens is you'll suddenly, as we make our way along towards that tip of the shoulder, just feel a big bulk of bone. That's this bone here, and then the tendons all pop out of that space. Now, for most of us, that's a happy relationship. The ball can roll around in that socket. But if we've developed dysfunction in the area, or even if we're just particularly strong, big sort of weightlifting type person who develops really big shoulders, these tendons can become thicker. Why is that a problem? Well, this is quite a small space in here. So if we develop these and they become thicker, as we start to move, they can catch and we can get that impingement pain. And bearing in mind there's nerves coming through this area as well, if we start to get this pinching or impingement, that can shoot pain down the arm. Or we can get this very localized point where we're actually impinging the tendons. So that's why it's really important that we're keeping this space as big as possible. Now, something that we want to understand about this space is that the space is bigger at the back of the joint than the front of the joint, if that makes sense. So if we look at the model here, if this the top of our arm bone starts to go forwards, you can see that that's quite a close space. Whereas if we can move it back here, it's a much happier space for this to work in. So the old adage of stand up straight, shoulders back is exactly correct, because what we look to do is set this back into the space to allow these tendons to have a happier relationship in there. But the problem is, I mention this a lot if you've seen some of my videos, is that we live in this flexion addicted society where we all want to end up in these rounded positions, whether it's typing at a computer, manual work, sitting at a desk, all leads to these rounding shoulders and ultimately moving this forwards and making this space smaller. So if we combine that then with the fact that we might have actually developed some dysfunction in this area, so perhaps some inflammation or some degeneration of the tendons, or as I say, just by weightlifting and things, develop these to be bigger, that can be problematic. So If you are experiencing this pain, and we often call this the painful arc syndrome, what can happen here is if we take our arm out to the side, it starts off okay because we're happy in that space, but then at 90 degrees comes that catch point. So if you start to get some pain there, and then going further you get pain, and actually it can then actually start to ease out right to the top. But if you're noticing this pain in that area, that could be a sign that you've got some impingement going on. So what do you need to do about it? Well, the key thing that you need to be doing is you want to be making sure that you are getting a full assessment to understand where that dysfunction is happening. As I mentioned, there's muscles on the top here, the supraspinatus. We've got the muscles at the back called our infraspinatus as well that are all coming up into this junction. I mentioned that we've also got the bicep that sits on the front of the arm as well. That's another one, whilst not technically part of your rotator cuff, also sits in this area. So damage to that bicep, or what we call the long head of bicep, can cause a problem in this area. So you want to be making sure you're getting that assessed to understand exactly which musculature is perhaps being the problem in the area. Things like icing can be helpful, anti-inflammatory, to try and reduce the inflammation in the area, can help that to be happier. But one thing that you could quickly look to do as well is to assess your own shoulder mobility. So if I'm suffering with the pain in the left-hand side, what we can look to do is simply take our right arm first of all and reach up my back as far as I go. That will give me a general assessment of the amount of internal rotation that I've got at my shoulder. What we often find in clinic is that the person presents with pain in one side will then be really reduced in that motion. So we know that they're tight or restricted in some of those areas that are passing through that space. So what we want to do is look to be improving that person's shoulder mobility. This is where something like a towel can be really helpful, because it's difficult to get that arm to get a good stretch from that position. But if you want to stretch that left arm, if you take the towel in your right hand and then throw it over that left shoulder, that gives me somewhere comfortable to hold on to the towel. I can then look to pull up that towel until I feel a stretch, typically in the back of the shoulder there. I can hold that stretch for 30 seconds. If that's gone quite well, I might lift it even further for another bout of 30 seconds. Remember, we're not looking to cause pain here. You just want to be feeling those fibers start to engage. But that will be starting to increase that mobility around the area. It will also look to start to stretch out any tight muscles. But again, when you get that assessed, you'll be able to really formulate a correct program, because the problem with the shoulder, as I said, is it's not a very stable joint. So what is absolutely vital is that you're getting a progressive program that settles down that musculature structure, but ultimately then builds the strength and builds the stability to enhance that stability at the generally weak shoulder area. So I hope that makes sense. As I say, if you are feeling that pinch in the shoulder, it's something that's super common. It's a very complicated joint in the area, with lots of these muscles acting and doing their best to try and stabilize what is a very mobile joint. So if that's happening, you want to make sure that we are working in order to get the shoulders back, perhaps strengthening some of those muscles at the back, increasing the mobility at the shoulder, calming down the inflammation in that area so that you can get that to be pain-free. I hope that that's been helpful. If it has, you can do me a favour and show me that this is the type of stuff that you want to be seeing by smashing that like button, because that will help others to see this and help YouTube to show it to other shoulder pain sufferers, of which there are many. And if you haven't subscribed to our channel but you want to see more from me, make sure you hit that subscribe button, because I will be super grateful for that, and I will look forward to seeing you on our next video.